For people who have lived through violence or natural disaster, survival is just more than getting better physically. Normally, even after a person recovers from an illness or heals from an injury, psychological wounds remain. So our teams, as you know, we're not in the rich countries, we're in the poorest of the poor countries. Because we choose to go where the health system is often collapsed or sometimes failing. And during these times when the health system gets overwhelmed, often people tend to prioritize services. And most of what falls behind or what is neglected are the mental health services. And it's quite an irony because the same situation that overwhelmed the health system, whether it's an outbreak, whether it's a natural disaster, whether it's war or conflict, it's the same situation that the general population have to face on a day-to-day basis. So it's also important that their mental health is well taken care of to get through the effects, the illness, and to get through the situation itself. There are many reasons for people fleeing their homes. War, conflict, violence, destitution, repression. People move, people leave their homes, not out of choice, but out of necessity. You will not live where you are if you have conditions that are livable, if you are safe, if you are able to become a productive person. Our patients, even though they have left the trauma that comes with where they came from, the trauma of conflict, the trauma of natural disaster, or the trauma of war, where they are now, they have to deal with a new set of trauma. They lack family support. There's a total breakdown of family structure. There is no services to anything. In these cases where a person is living in very horrid conditions, most of them tell us that we feel like we are not valued as a person anymore. We are less than a person. More than providing medical care, more than treating the bruises and the injuries sustained from that crossing, what we really try to do is to help people believe in themselves and believe that they still have their dignity and that they can go on in their journey. We are there to make sure that they are ready, emotionally, physically, for whatever decision they make. In most of the instances, we have quite a protocol for how long or how many psychological sessions the patient has to go through. But ultimately, it is the patient who will also tell us when they are healed. We adjust to how the patient is improving. It's very difficult because you cannot say that you after 5 sessions you're okay, you after 10 you're okay, and you need as much sessions. So you actually follow the progress of the patient. And through that whole experience, you have to work on their coping mechanisms and actually that they find the strength within them and that they are able to care for their own mental health. So once the mental health care provider and the patient reaches a point where they both see that the patient can already take care of their mental health without much external support or with support from their family and friends, and that's when we can say that the invisible wound is already healed.